Thank you for listening to today's Here's to Your Health podcast. I'm Don Lintzman, your host. On today's podcast, we have several very special guests with us today. Tiffany Ransom, who is our Patient Access Manager here at CCMH, Kendra Hartwig, Patient Access Rep, and Christine Myers, Patient Access Rep. And thank you all for joining me today. I appreciate it very much.
Thank you.
Thanks, Don.
It's very rarely I have three guests, so this is a brand new deal for me. I'm sure it is for you. We're going to talk about patient access because this is Patient Access Week, and we're going to talk a little bit about what patient access is and what our patient access department does for us. But before we do that, I want to make sure that everybody understands who it is that we're visiting with. So Tiffany, I want to start with you. A little bit about your background and how long you've been at CCMH.
Yep, I've been here 17 years this summer. I started as a patient access rep on overnights. I have been in patient access, financial counseling, billing, and now I've circled back around to patient access again.
And we're going to talk a little bit about what that is, because I'm sure, like we discussed before we got started recording today, is that you can't assume that I know everything about what goes on in the hospital, because I don't. So you're going to tell me, just as well as the people who are listening today, you're going to help me learn a little bit more about what it is that we do. Kendra, a little bit about you and how long you've been here and what your current role is.
Yes, so Kendra Hartwig, I am a patient access rep lead for the hospital side, and I have been here since March of 2023.
And Christine Myers.
Yes, I am patient access lead in the clinic. I've been here since November of 2022.
So a relative neophyte compared to the other two people that you're working with, although not quite as much as I might imagine you are. Well, let's begin at the beginning, and let's just talk about, Tiffany, let's just talk about what the role of patient access staff is.
So our patient access staff, we help patients access and use our healthcare services that we offer here, provide them information, resources. It's really a crucial part of healthcare as it affects the quality and availability for patients to get the care that they need when they need it.
And what we talked about before we started recording today is that really patient access is like the front door.
It is.
It's where people actually enter the healthcare system. Here's, I think, the misunderstanding that most people have about the role that patient access occupies, and that is they think you're there to bar people from doing things, which is the furthest thing from the truth. You're actually there to help try to make this process easier, better, quicker, faster.
Correct. Yep.
And some of the things that people maybe don't understand are how you go about doing that.
Yes, we try to get them to the correct provider, to the correct place in the facility, or the correct department, whether they need medical records, help with their billing that they may get, questions on their bills. We also help coordinate with interpreters. Pretty much every department in the facility, we coordinate with. We get patients that come through the front doors for every single department.
And Christine, I've got to imagine that working in the clinic, you get all kinds of certain requests during the day for all kinds of things that have nothing to do with actually getting an appointment.
We do. We get some very interesting calls, but we do the best we can and get them to the services that they need, even if they aren't specifically related to the hospital. I know we've had some where we've transferred them out to other facilities or things of that nature.
And Kendra, I know that working on the hospital side is different than being on the clinic side. And maybe you can describe for us a little bit of what the difference is between the two.
So hospital and patient access specific, we're going to be checking patients in and out of the emergency room, and then any outpatient services. So that's going to be your lab, your radiology, specialty clinic, those that are admitted down to our med-surg floor, same-day services, and anything that uses an OP or an OR room. So,
my guests on the podcast today are Tiffany Ransom. Tiffany is our Patient Access Manager. Kendra Hartwig, a Patient Access Rep on the hospital side, and Christine Myers, Patient Access Rep on the CCMH Medical Clinic side. And Kendra, why don't we talk just a little bit about what Patient Access Week actually is?
So the Patient Access Week celebrates the anniversary of the founding of the National Association of Healthcare Access Management. shortened up to be NAHAM, the only national professional organization dedicated to promoting excellence within patient access. Patient Access Week this year is extra special because it marks the 50th anniversary of NAHAM. This week, we get to celebrate the hard work and dedication that our entire department puts into enhancing guest relations, boosting hospital morale, and improving communications.
And I would like to think that maybe what people who are our patients in particular, who are trying to access the healthcare system, I hope they would understand that we're here to help. But typically, they're under some sort of stress. Either they're not feeling well, they think they have a serious issue, and so I think sometimes they misinterpret the questions that we need to ask in order to be able to get them what it is that they need. And I don't know if anybody wants to comment on that, but I would like to think that if everybody just took a step back really, really quickly, they'd understand that we're here to help. We're not here to do anything else except help you get what it is you need.
Hospital side specifically, we try to take the bare minimum needed, like your date of birth and your name, so I know that I have the right person back there being treated and that we're applying it to the right records, but at the same time, making sure that we do have any information updated for you before you leave the facility so that we can get in contact with you and then transfers over to the clinic side when they need to make a follow-up appointment.
We also try to take a step back as patient access and realize people that are calling in, coming through the doors may not be the best version of themselves. They don't feel well. A lot of times these are people that we see out in the community that know us. So we also try to keep that in mind, that the interactions that we have with them here may not be the same interactions that we have with them outside.
Christine, if there's one suggestion that you could give to patients who call the clinic, there are probably pretty typical questions that we ask. Should we have information? Because I need to make an appointment, by the way, so I'm asking for a friend. Is there information that we should have readily available to share in order to be able to make this process work better?
So typically the questions we ask when a patient calls in is your date of birth, your name, what you're wanting to be seen for, who your provider is, and we like to confirm insurance so that we can effectively have that insurance in when you're coming into the clinic. We can have everything set up and just confirm it when you get here as well. Typically everybody that we get on the phone is pretty patient with us, so.
And again, everything you're asking for are things that are going to make the visit go that much more smooth.
Right.
My guests on the podcast today are Tiffany Ransom, Patient Access Manager, Kendra Hartwig, Patient Access Rep, and Christine Myers, Patient Access Rep. We're talking about the 50th anniversary of National Healthcare Access Management Week. And this is a very important part of what goes on in healthcare, but one I think that is overlooked more often than not. Tiffany, just in your opinion, what do you think is most important for people to know about patient access?
We really touch every patient that comes through the door, as well as every department. So patient access plays a huge role, and a role that a lot of people aren't even aware maybe exists out there.
There's an awful lot that goes on behind the scenes that I think people, again, not to say that there's some sort of magic or voodoo or whatever that perhaps there is, I guess I don't know that, but I don't think so. But there is an awful lot of administrative work that goes on out of sight that makes all of this stuff work really well for people. And I don't know how else to explain it better than that. But maybe, Christine, you can talk about if we don't have access to healthcare, we lack access to healthcare, who gets affected by that?
So patients with chronic diseases or disabilities living in poverty face challenges in receiving care. Inadequate health insurance coverage is also one of the largest barriers to healthcare access. The unequal distribution of coverage contributes to disparities in healthcare also.
And probably, and any one of you can address this, but probably some of the language barriers, some of the cultural barriers, especially in Denison. I don't think it's any secret that we have a lot of different cultures in Denison. That has to in some way affect how we interact with patients.
Absolutely.
It does. We have a lot of great ways to communicate with patients where English is not their first language. We have in-person interpreters that are here either staffing or on call 24/7. We've also got the language line, which we've had for several years. And then recently we started with a Propio iPad. So we can video chat or voice chat in, I don't even know how many languages are on it. We've never run across one that we weren't able to find.
And when we talk about barriers to healthcare, language is one of those. Obviously, culture is another one. And so I'm just going to put in a quick plug for the patient transportation service here at CCMH, because transportation is also a huge barrier for
Absolutely.
people who can't make their appointments, that are not able to get to and from. And that's a free service. So we're saving people a ride, the cab fare or whatever the case might happen to be. So there are a lot of barriers to healthcare accessing it. But I think we're doing a pretty good job of trying to make certain that we remove as many of those barriers as we possibly can. To finish up today, Kendra, why would anybody want to become a patient access rep? We've talked about all the downsides to it. I mean, the unhappy patients and the language barriers and so on and so forth. Why would anybody want to do that?
I think all three of us can attest to the fact that we, as patient access, have the unique ability to be able to interact with the patients that receive care in every single department of our facility. And then we also get to interact with the employees and providers that work in those departments as well.
Christine, how about you?
We offer competitive salaries and a positive job outlook. We have our careers as patient access reps is an attractive option for those looking to join the healthcare industry as a whole.
And Tiffany, probably patient access rep would be one of those places. If you have a desire to have a career in healthcare, that would be maybe one of the very first steps, is to get this sort of experience within the healthcare system, gain some knowledge about how the process works, and then we have about 250 employees here. There are other places in the hospital that you could go to work if you wanted to graduate out of that particular experience.
Absolutely, yep. It gives you a good idea of what all goes on inside the facility, inside the clinic, the hospital, every department.
And from what I can see, you've got a great department, and you got at least two of them right here with you today.
We do.
Absolutely.
We're the fun department.
Well, I certainly appreciate your time. We've been talking about Patient Access Week and celebrating that, and we've had several special guests with us today. Tiffany Ransom, Patient Access Manager, Kendra Hartwig and Christine Myers, both patient access reps, and thank you all for joining me today.
Thank you.
I'm Don Lintzman, your host for the Here's to Your Health podcast. Thank you for listening. Have a great day.